I'd like to thank Metropolitan Municipality of İzmir, together with the Infectious Diseases Prevention Association, BUHASDER, and the Turkish Society of Clinical Microbiology and Infectious Diseases, CLIMIC, for inviting us to this first World Pandemic Conference to be held in İzmir between 22nd and 24th of June 2021. I have distinguished friends, colleagues with me here to have a conversation about Pandemonics 3.0, from crisis to transformation today. Our first speaker is Professor Ian Miles, a professor at the University of Manchester, Manchester Institute of Innovation Research, also at the National Research University Higher School of Economics. We also have here Joe Ravetz from Manchester Urban Institute. He is the leader of Future-Proof Cities. So welcome both. It's my great pleasure to have you here. We have formulated some questions today to discuss with, and we will look at the pre-pandemic period and the pandemic period and the post-pandemic period. So what would happen actually after the pandemic ends? So first of all, without taking too much time, I would like to begin with the first question. What do you think? So did we already predict the pandemic before it actually happened? As the Foresight experts, I would like to hear your opinions on that. So let's begin with Ian.
Okay, thanks very much. Well, I have a PowerPoint slide where I presented the main things we got right and the main things we got wrong. We clearly had expectation of pandemics by epidemiologists, virologists, many people working in public health. We didn't know when it was going to happen. We didn't know precisely what the disease would be like, but that something was going to happen as a result of human activity was pretty well consensus. And in many countries, there have been exercises, specialist foresight studies designed to look at what would happen under such circumstances and what our resilience was. And some of this work was really good work, I think. It mapped out strategic responses. It looked at actions to control disease transmission, to protect public services and the like. And it did lead to some policy action, funding for research on gene sequencing, for example, of diseases, funding for some other sorts of genomics work and virology work. But clearly we saw that when this pandemic happened, we were not well prepared. And foresight work in general had tended to relegate pandemics to one of the topics which we might need to consider, but we're focusing on something else. We're focusing on artificial intelligence, for example, or some other topic like that. Most of the pandemic forecasts had really focused upon something like flu, influenza, and while COVID has some quite similar features to this, there are also many distinctive features. And one of the things we're now discovering is the nature of long COVID, that disease symptoms can seem to persist for a very long time, for months, possibly longer. And also there's quite a strong health toll of a lot of our medical treatments. It's not necessarily very good to have been in intensive care with a respirator for a period of time, for example. And what we saw was that the foresight studies that have been conducted on this topic, while they'd got some things onto the political agenda, had failed to alert policymakers to the seriousness of the issue and failed to get a response in terms of adequate storage of personal protective equipment, for example, the ability to rapidly roll out new treatments and the like. And we actually hadn't really expected to be able to achieve the very rapid development of new vaccines using new technologies and genomic methods that has been achieved here. And that has been a great success. But a lot of the forecasting had not anticipated that we would have a vaccine for, say, 2 years or so after the disease was first recognized. And thus planning assumptions were somewhat misguided as a result of this.
Yeah, thanks for that, Ian. And Joe, you have also a great experience in foresight and forward thinking, and I'm sure you came across to the topic of pandemic maybe a decade or more ago. So what was your thinking when the pandemic actually rolled out?
The thinking was that Foresight was missing one or two tricks. And one is to say, yes, we had done the risk assessments, national risk assessments, global risk assessments. We had looked at the combination of pandemics with climate change, with political instability. In fact, maybe I could just show you a quite colorful slide here, now that I've got my system up. Just very briefly to kind of illustrate this. And what we see here is, as you can see, a virus in the center of a game. And the game is being played on a big board. And the virus, on the one hand, is mutating into all kinds of other social problems, migration, climate change, financial instability, political conflict, and so on and so on. And we call these in the trade deeper threat multipliers. In other words, where the pandemic is not simply a health problem, a biomedical issue, it then intersects with all kinds of other issues in society, which then make it more difficult to manage, to understand, to forecast, and ultimately to respond. So, and we've learned a lot in the last year and a half, actually. One of the things that I'm hoping we can learn and take away is not only, how to manage, the biomedical side, the public health side, but also how to do this kind of thing better. In other words, if the Foresight studies were done, but then they were put on the shelf of, the policymaker's office or the Prime Minister's suite or whatever. And we saw this very clearly in the UK and in many other places that, there were studies, but they were not taken on board. The provisions were not made. It was the wrong kind of pandemic. Most of the studies were concerning a flu, which in the detail is very different to the coronavirus, and so on. So all of which, well, I think, we can learn from this. Just to explain this colorful cartoon, well, we have these deeper threat multipliers. On the one side, everything goes wrong and more because everything piles up and combines. On the other side, there is the possibility that, yes, we can look for the synergies, we can look for the good positive outcomes, which are many in this pandemic experience so far. But also we have to say, if we have a situation where the people and the governments are divided, they don't trust the science, they don't trust the governments, they are not doing the best possible thing in this difficult situation. So then we have to ask who can turn this crisis to opportunity and how. So I'll stop there.
Yeah, sure. So this is actually an excellent picture in terms of showing the systemic nature of the pandemic. So it isn't simply not a health issue. It is both caused by multiple different factors, maybe at different scales, at global scales and local scales, starting from globalization and then economics and employment, living standards, culture, and etc. And the solution also requires systemic thinking at also multiple levels. What we saw actually, as far as I understand from both Ian and what you said, is that there's a gap between foresight and policy making, and we definitely should fill in this gap with some proper actions with the participation of all the relevant stakeholders. We see that actually governments, industry, research institutions, health organizations, practitioners, and the society, they need to work all together in order to address all these problems. So obviously, yeah, this is the case. This is how we reached to this point of pandemic, and then now it's a global problem because we live in an interconnected world very much. So because of the mobility of people and so on, so it's spread it all around. And so far, actually, it has advanced a lot, both the pandemic itself and the solutions to that. So during this period of time, so if we consider the last 1.5 years, what do you think we learned from this experience? So how we can, basically I'm asking to understand how can we use this experience better in order to be prepared for the next crisis, whether it's pandemic or else. So Ian, maybe we can begin with you.
Right, thanks very much. And I see that there is currently a debate underway about whether the UN should be setting up a body to deal with major risks and threats that confront humanity. And there are certainly big threats, and I think we should probably get behind that initiative. I think we see several opportunities that we've achieved that come up from the pandemic crisis. One thing is that we have seen that states can do things which we had regarded as unrealistic. For a long time, we've been told, for example, that we can't deal with the climate crisis because it involves such a lot of change, because the public won't accept that. And we've seen that states can actually act very rapidly and introduce some very large scale initiatives when they're confronted with a huge systemic crisis. And we've seen that much of the public is able to get behind these difficult policies, these inconvenient truths that we're confronting. And it's actually been quite a big boost for science in terms of science having ridden to the rescue with solutions like vaccine development, with rapid learning about improved medical treatments and the like. We've also seen that there can be quite a lot of bottom-up activity all over the place. Communities have developed their own support programs to help each other out with issues that like social isolation, like the need to get services and shopping and things like that. That obviously isn't the case in some of the most stricken communities. We hear tragic stories from, for example, villages in India where parents are dying and there's nobody left to look after their children and things like this. But in places which haven't been quite so badly hit, there's been a lot of bottom-up activity, which is really refreshing. I see that we have to do better, though, in many of these things. We have to take risk assessment much more seriously. These risks that people may have been regarding as wildcards, though they weren't really wildcards, need to be built into a lot more foresight work, but they need to be built into policy making and strategic planning of all sorts more generally. And we need better ways of communicating these risks to publics as well as to policymakers. This is a cross-national issue. It's not just something which one country can be handling alone. Thank you.
Yeah, thanks, Ian. Joe, do you have any colorful slides to show on this topic?
Well, I will show a colorful vision of alternative futures, if I may. Right. This one was very popular actually a year ago. Because we were saying, okay, actually at this moment, a year ago, we don't know if the pandemic is solved, you know, it will be just fine and the solution is there, or if the pandemic is ongoing. And now here we are a year later, middle of 2021, we still don't know if the pandemic is really solved or if the pandemic is ongoing. And yes, you know, the developed countries have the vaccines for the most part, but there are new variants, new strains, and so on. So we also asked the question to our panel a year ago, do you think society will really make the changes needed to adapt and survive and thrive with the new situation? Or do you think we will just get back to business as usual as soon as we can? And so we have, 4 kinds of possibilities. And this is the cartoon version. Obviously, there is then a, analytical version, if anyone wants to know. But where we begin the journey of systems analysis, not only the biomedical system, but also the social and economic and political systems which surround it. It's a very big agenda. But what you can see here is that it's not a neutral agenda. Each part of society is pulling in a different direction. And let's say there are some parts of the world and some parts of every country where people want to take control. And if we have a lockdown, yes, this will be, heavy security. And if you don't fit, you can't get through the scanning, sorry, you are not allowed, and so on the lower right. We also then have other people pulling in the direction of the upper left. And you say, oh, let's have a social transition, a social revolution even. We don't need material values anymore. Let's just party in the streets. And this is very utopian, but a lot of people were really feeling this way a year ago. And then, of course, you have the other, the lower left. Let's go shopping and make our country great again, and so on and so on. And then the top right is where you have some kind of technical solution. The pandemic is ongoing, but we rely on new technologies, as you can see, to cope and try to live a normal life. Now, I've kind of taken your question 2 and stretched it into question 3. Apologies.
It was a good bridge, actually, so that is fine.
So maybe I can hand back to Ian, who also has a couple of things to say about the future.
Yes. So what is next after the pandemic?
Thank you. Well, I too was looking at possible scenarios, and I think mine are very similar to Joe's. If you turn my diagram upside down, and if you put some nice pictures in, such as Joe had, and what the difference is between us is that Joe's scenarios were very much created with thinking about urban futures, and I was thinking much more of the global dimensions here. 2 aspects of the global dimension. One is that the pandemic has revealed to us that public health is a global issue. In particular, if we don't have most of the world protected against COVID-19, then it's going to continue to mutate, to produce new variants, to cause us endless headaches. We're already finding the Delta variant to be far more resistant to the vaccine than previous variants were, for example. Unfortunately, it also looks like it's got worse health impacts. Again, many diseases tend to get less serious health impacts as they proliferate, but not in this case. And if 2/3 of the world remains unvaccinated, then we're going to see a proliferation of new variants. In fact, we do see a proliferation of new variants. There are well over 100 variants around. It's just that most of them are not particularly worse. So, thinking about scenarios, it seemed to me that one big issue is whether there's a shift towards better global public health, or whether this is ignored and countries focus on their own immediate interests. And we have a scenario like the one in the top left here, dog eat dog. And a few rich countries may be able to pursue the strategy of vaccinating their population and rapidly developing new vaccines to deal with new variants of the disease. It's a possibility. It's also a world, I think, where we see increased international conflict and liable to be spiraling down in terms of the other great global crisis, which is the climate crisis, which we are also going to need to resolve in the very, very near future. We can't afford to let that one wait. The other scenarios involve more global action, but without international cooperation. That's the top right. More global action with quite a strong measure of international cooperation, global public health initiatives. The jargon in the UK right now is leveling up, trying to bring circumstances everywhere to much the same level, but very much on a top-down basis. And on the bottom left, we have a scenario where things are much more fragmented, but there's a great deal of activity from more of a bottom-up perspective, with many individual groups, and this would include urban groups, it would include community groups, it'll also include groups of scientists engaging in their own innovations, their own patterns of activity, and linking together, but not linking together necessarily in a very well coordinated way to come up with solutions to the pandemic and to the global climate crisis.
Mm-hmm.
Thank you.
Yeah, thanks, Ian. So this is actually, of course, a very thought-provoking picture, especially considering that the pandemic is still going on, and it is still as serious as it was a year ago. Maybe it is more serious. And in this kind of context, of course, you know, our like usual foresight exercises which think about the next 10 years or 20 years are now focusing on almost tomorrow or the day after tomorrow. So and the scenarios actually came into, you know, the scene sometime soon. So here actually what I learned also in terms of futures thinking, maybe the long-term futures thinking has lost its relevance. So uncertainty and complexity came into the picture more at the forefront than the time horizon that we are, you know, considering. And so probably at some point, of course, it seems like this will continue the discussion, and then we will probably see even more damage on our societies and economies if the crisis goes like this. But we are hoping that at some point this will be over, and hopefully a distant memory for many of us or most of us, without leaving anyone behind. And so we will have something, you know, to learn from all this experience. So that actually brings me to the last question for today. How we can make use of our foresight to turn this crisis into transformation. Not only in terms of like avoiding future pandemics, but also getting ready for what might arise as crisis in the future. Doesn't matter where it originates from, because we are living in an interconnected world where a lot of social, technological, economic, environmental systems interact. So future crises may originate from any of those. So my question is, what can we learn from this experience, from this crisis, in order to actually create necessary transformations to maybe achieve more resilient social, economic, and environmental sustainable systems for the future? So Joe.
So yeah, I'm glad you asked the question, and you are asking also if foresight and similar future studies cannot deal with the complexity, you know, then what can we do? How do we look ahead? And my answer would be to say, okay, we're not only dealing with complexity out there, we are dealing with the capacity for learning in all parts of society. And just to illustrate that on a little kind of diagram level. So if we say, oh, here is our pandemic, it is causing a big problem. How do we fix that problem? And here you see the image of, you know, the building falling over, etc. And then there is another level to this, beyond the simple and linear system kind of approach. And we say, oh, what if, in order to fix the problem of the pandemic, we have to look for how people innovate, how they create, how they evolve into new situations. And then we can say, yeah, actually, so the pandemic is a big issue, but we look for market solutions, we look for political solutions, and for social change, but which is evolutionary. And what that means is usually that we get inequality, exploitation, waste, pollution, and so on and so on. And we saw many examples of that in the UK, where suddenly, huge contracts for the PPE and the test and track and trace thing were handed out, to right-wing politicians, friends of right-wing politicians, and so on and so on. A lot of money was wasted, but a lot of people made some money. So apparently everyone was happy about that. So we then have to say, okay, so what kind of society are we looking to create in the future? What kind of transformation does that mean? And then how do we build the experience of the pandemic into that transformation? So this is a kind of simple picture. Then we can say, yeah, maybe there's a different kind of economics, all the way from the industrial model of, you take the materials and dump the waste, all the way over to something which is more collaborative and recirculatory and co-evolutionary. And the same thinking goes for technology, communications, and especially the political systems. And we saw again, the countries who did best in the pandemic experience, well, by coincidence, these were headed by female leaders. That's complete coincidence, obviously, but they tended to have a consensus-based way of working. Not to say that everybody just did what they wanted, but rather to say, yeah, if government has to make a difficult decision, they bring everybody into that room and at least tell them or involve them in that discussion, and so on and so on. And yeah, the ideal case was New Zealand in that sense. And then just to see how that plays out in very, very practical issues. So a year ago, we started analysing the basic parts of pandemic management: the hands, the face, the space, the track and trace, and so on and so on. And we say, oh, okay, so actually, there's different ways of going about this. On the left-hand side, if you're doing hands, face, and space, well, you're just trying to solve the problem. And the issue is then, not everybody agrees. Not everybody wants to do this. If you ask them to isolate, they cannot because they are going to lose their income, and so on and so on. So then you can start to play out all the combinations and say, well, what is a wise solution? What is a 3.0 kind of solution? So, okay, so we get the hands thing integrated into workplaces, communities, places of leisure and education, and so on. The face thing, similar. The space thing also, and so on. And then we can go on through the long list of items which start as biomedical responses and end up as potential transformation of many parts of society. Not to say that everything has to change right now, but rather to say, yeah, we have a way of building this in. I work in a university, and actually we made so many huge mistakes. Oh, the place is shut, you have to work online. And then, the student accommodation was shut, and so on. And a little bit more foresight or forethought, maybe we could have done it much, much better. So this is what I'm now keen to work on, and I'm interested to work with anyone also on this agenda.
Yeah, Joe, many thanks. So I'd like to give a final word to Ian to tell us how we can use foresight to turn crisis into transformation.
Thank you. One point to make is that there are bound to be future pandemics. So we have a lot to learn from this experience. And the solutions, as Joe said, the solutions are not short-term fixes, whether technology or not. We're in it for the long term. So as John was saying, our foresight horizon has maybe shrunk to something much more immediate, but there are no solutions that can just come into play right this minute and then the problem is solved for all time. With pandemics, the problem is going to recur, and with environmental problems. Many, many problems are confronting us there, and they're not going to go away. We have a great deal to do to return large areas of our planets to a decent state. So we need long-term visions. And these long-term visions are very important if we're going to have people working and realizing that they're in it for the long run, that it's not just a matter of acting today and then everything is going to be okay tomorrow. We need long-term visions, scenario narratives that can remind us what is a sustainable path, what paths turn out to be dead ends where we go into crisis and collapse. That seems to be a very important element of achieving any real transformation, the recognition that transformation is absolutely necessary. Transformation will be an evolving thing. It's not a matter of coming up with a plan or manifesto today and then rigorously implementing that step by step into the future. The plan itself is going to need to evolve, but we need to have a very clear vision of what sorts of things will be necessary in order to achieve global public health and a sustainable future for us all. And that's the main message that I want to give out. The main or a major challenge is that we're in a world where there are malicious actors, and we've seen this in play very much in the current pandemic, and of course in politics in general. The proliferation of bots and trolls on social media, for example, that are putting out messages that are merely designed to sow discord and confusion among people. Challenging this without suppressing legitimate debate is one of the big problems we're going to confront over the years to come. Thank you.
Thank you. With this, I'd like to thank Professor Ian Miles and Joe Ravetz for joining this session. I am Ozcan Saritas. I'm very pleased actually to have this conversation and to provide it to the conference attendants, to the attendance of the first World Pandemic Conference. And I would like to thank once again to the Metropolitan Municipality of İzmir, the Infectious Disease Prevention Association, and the Turkish Society of Clinical Microbiology and Infectious Diseases very much for inviting us to this session. So we are wishing everyone a successful conference.
Yes.
Thank you very much again.
Thank you.
Goodbye.
Thank
Thanks.
you. Goodbye.
Bye-bye.